Hello everyone, welcome to HIM 225. In this lecture we are covering chapter 20 in your textbook. It begins on page 473. We're covering chapter 13 in ICD-10, diseases of the musculoskeletal system and connective tissue. We're going to be going, as always, I recommend that you look at the abbreviations and the acronyms, that you look at the glossary terms that are at the end of this chapter, and that you also look at the homework assignment, see what you're going to be doing for homework. I want us to take a look at this in the tabular. So we're at chapter 13, and you see that we have a note here that applies to this entire chapter, and it tells us to use external cause codes following the code for the musculoskeletal condition if it's applicable. And of course that means that we would be coming over to the external cause tab and using that index and looking up those codes. We have an excludes note 2 here for these conditions, which I'll let you look at, and now we're going to look at the section list. And let's see if I can get this up. So you'll see that we have arthropathies. We're going to go into these and look at them. Osteopathies and chondropathies. So let's take a look and just go into these different sections and take a look at them. You can see that we have an excludes note for this particular section. Disorders affecting predominantly peripheral limbs or joints. That includes peripheral limbs or joints. I'm not going to read these to you, but I want you to get an idea of what is included here. Osteoarthritis is included in this category. We're going to talk about the osteoarthritis. Then dentofacial abnormalities, other disorders of the jaw, quick little category, only 2 categories in this particular section. Then we have the systemic connective tissue disorders, necrotizing vasculopathies, we have soft tissue disorders, disorders of the muscles, synovium and tendon, and then other soft tissue disorders. So we're going to look at these osteopathies, disorders of bone density and structure, other osteopathies, and then chondropathies. I want us to look at this category. No, that's not the category. This is a category for osteomyelitis, osteonecrosis. These are conditions that are affecting the bones. And so disorders of bone density. So osteoporosis is a disorder of bone density, and we're going to be looking at the coding guidelines that deal with osteoporosis. I want you to notice that M80 is osteoporosis with current pathological fractures. And osteoporosis is a systemic disease. When we look at the actual codes for osteoporosis, sites are not identified because osteoporosis is systemic. It affects all the bones in the body. But when we look at this category for osteoporosis with a fracture, what we're looking at is the actual site of the fracture. And patients that have osteoporosis and have fractures, those are pathological fractures. They are not traumatic fractures. You will often see an elderly patient who falls and breaks their hip. Well, the question is, did the trauma of the fall break that hip, or did the hip break and then the patient fell? And if a patient has osteoporosis, it's very likely that what happened is their hip broke and then they fell, and it was not the actual fall that broke the hip. We know that patients with osteoporosis that break their hips, it definitely impacts their longevity. Many of those patients are in the hospital for a short period of time. They are then sent to rehab, and then they go home, and I think the average lifespan for a patient after they break a hip is about 5 or 6 months. When we're looking at this category, this includes osteoporosis with current fragility fracture. We have an instructional note to use an additional code to identify a major osseous if it's applicable. We have an excludes one note, and this is for a collapsed vertebrae, a pathological fracture NOS, which means it's not associated with osteoporosis, and then wedging of vertebrae. Now, if the patient has a personal history of a healed osteoporosis fracture, there's a code Z87.310 that we would apply to those patients. That's why you have an excludes note too. In this category, we have a 7th character, and the 7th character has to be added to each code that is in this category M80. So every code in this category is 7 characters. The 7th character is going to be one of these letters. If it's the initial encounter, it's A. And unless the documentation tells you differently, it's an initial encounter. And the guidelines tell us that if a patient is being treated for an active fracture, it's initial encounter. If a patient is seeing a physician they haven't seen before for this fracture, it's an initial encounter. If the physician treating the fracture is continuing to treat the active fracture, it's an initial encounter. Subsequent encounter is used after that fracture is healed. So once the acute condition, the acute fracture is treated and healed, and they go back for follow-up, then we use this 7th character of D for a subsequent encounter for routine healing. Now, we also have codes that indicate that the patient is not having routine healing. Let's say the patient is having delayed healing. That'll be documented. There is a non-union of a fracture. That will be documented. A malunion of a fracture will also be documented. And then if it's a sequela, meaning a late effect of that fracture, we would be using the 7th character of S. So let's just look through these codes in this category. So for instance, in the first category, we have a current pathological fracture unspecified site. Not very likely that you will ever use that. Then next we find the pathological fractures for different body parts. This, we can see that shoulder. It's broken down to right shoulder, left shoulder, unspecified shoulder. We're going to see that pattern continue. Next we have humerus, right, left, unspecified. Then we come to forearm, right, left, unspecified. Hand, right, left, unspecified. And so on and so forth. I'm not going to read all of these to you, but you can go down and look at those. Then we have a code, other osteoporosis with current pathological fracture. And this might be a patient that has drug-induced osteoporosis, idiopathic osteoporosis, osteoporosis of disuse, post-oophorectomy osteoporosis, post-surgical malabsorption osteoporosis. So there are some osteoporoses conditions that they can attribute to a specific condition or event. And again, with these other osteoporosis codes, they're by site and laterality. And that's one of the things that we will find in Chapter 13 is most all of these codes include both site and laterality. So let's look on page 474 in your textbook. There are some things I want to point out to you about these codes. For some conditions where more than one bone is involved, such as osteoporosis, there is a multiple sites code available. So if there's multiple sites available, then you can use that code. But for many of these categories, there is not a multiple site code, and then you would have to apply the code for the bone, the joint, or the muscle that was involved. You have to use multiple codes to indicate what's involved if there's not a specific multiple code. That's a mouthful. For certain conditions, the bone can be affected either at the upper end or the lower end, and the example they give is avascular necrosis of the bone. And it tells us that though the portion of the bone affected may be at the joint, the site designation will be the bone, not the joint. Now, Guideline B talks about acute traumatic versus chronic or recurrent musculoskeletal conditions, and this is important. It tells us that many musculoskeletal conditions are the result of a previous injury or trauma to a site, or they are recurrent conditions. If we have bone, joint, or muscle conditions that are the result of a healed injury, or are usually found, these are usually found in Chapter 13. Recurrent bone, joint, or muscle conditions are also usually found in Chapter 13. So if it's a recurrent condition, if it's the result of a healed injury, those codes are typically found in Chapter 13. Any current acute injury should be coded to the appropriate injury code from Chapter 19. Now keep that in mind. You'll notice that when we were looking through this chapter, we did not see the traumatic fracture codes. So if we go to fracture, look at fracture non-traumatic, M codes, meaning they're in Chapter 13. Fracture pathological, M codes, meaning they're in Chapter 13. But if we go to fracture traumatic, they are in Chapter 19. They are S codes. They are not in Chapter 13. So you need to be very aware of that. For instance, if someone dislocates their shoulder, that is going to come from Chapter 19. That's an acute injury. But if a patient has a pathological, hold on.